Hi, good afternoon, everyone. I'm Sarah Holt, healthcare consultant for HOK. Thanks for joining us here on this LinkedIn Live conversation about designing for the human experience in healthcare. Today's healthcare buildings are more than just clinical spaces. They're ecosystems where patients, families, providers, staff, and researchers intersect. When we talk about patient experience, we're often limiting the conversation to just one type of users, but in reality, it's far more complex than that. There's an interplay between all of those roles I just mentioned among hundreds of others. Today, I'm joined by two colleagues who have helped lead some of HOK's most ambitious healthcare design efforts. Colleen Harrington is a senior product interior designer based in Philadelphia, and Mark Van Hulter is a senior project director designer based in Chicago. So let's go ahead and dive in. I want to start out with the first question to you, Mark. I'm interested to know how you would define experience in healthcare design and how you might approach it.
Well, thanks, Sarah. I think, one of the things that's really most important is to understand that, this is really about creating environments for engagement. It's about how do you design in a sense that allows people to connect. There are, as you said, so many different diverse users, but great outcomes really become part of how we create that sense of opportunity for creating an ecosystem for communication, whether it's caregiver to caregiver, caregiver to patient, patient to family. It's really about designing that type of space that really creates that opportunity for togetherness.
Mm-hmm. Intersection almost.
Exactly.
Yeah. Colleen, what are your thoughts?
I agree with everything that Mark said. I also feel that designing, for the experience for everyone reinforces all of their emotional needs, along with taking into consideration the physical needs as well. It's a balance between that environment reinforcing that they're in the right spot, or to Mark's point, that they're in a space where they feel safe to have an open conversation. Things like that, I think, are critical to human-centered design.
Yeah. And I think actually, as you kind of both alluded to, it's the idea that there's a lot of different people in this space, in each of these healthcare spaces, and they're not always there just because they're sick. They might be there for other reasons too. So are there any other things that you can imagine that might occur in a healthcare space that, and I really mean the healthcare space broadly, maybe like a hospital setting? Are there specific environments within the healthcare setting that we need to be thoughtful of, to think about all those users, places that they might use when they're not necessarily the patient, or they're or not necessarily visiting a loved one?
I'll jump in and take that one. I think, often I've said that hospitals, in a sense, are now the new town center. I mean, healthcare systems are really about engaging their community. We've done a project, Eskenazi Health in Indianapolis, and it really was about creating a destination for the community. So as you said, it's not just about the people that are ill that are in this place. It's about how we create an environment for engagement to talk about wellness. So we created with them this large outdoor space that the hospital surrounds. And that really becomes the place where they have all sorts of different community events, farmers markets. Again, it runs the whole gamut, but it really is about how do I invite people in? And in that process, then I can have a conversation with them and introduce them how to live healthier lives. So I think that's just one example of how that happens.
Yeah. Colleen, any thoughts about that outdoor space that Mark just described?
Oh, the outdoor space. Yeah. Well, I think outdoor space is equally important for the staff. They also need that opportunity to perhaps step away, have a different place to interact with each other. So I think that those outdoor spaces, support both the community the visitors to the building, be that patients or family, but also they benefit the staff significantly in terms of, being able to step outside sometimes can, whether it's alleviate stress or just put a smile on your face or just give you a moment to breathe for whatever that reason might be. I think the outdoor space, supports, as Mark was saying, supports everybody.
Yeah, absolutely. Are there specific components or drivers that shape a great healthcare experience for all building users? Anything that might be focused on, say, the layout or maybe the process, any community context or influence that might play a part in developing and influencing experience for users in a specific setting?
Well, I think, as you said, each one is different. It's not a cookie cutter approach. And so I think as designers, we really need to start with asking the questions, doing the research, who is involved in this community, so that we can, in a sense, curate and tailor with them what is familiar. Because again, I think the positive experience is based on what is familiar and what do I feel comfortable with.
Okay.
So I think that's really important in how we engage and go through visioning, ask questions, take their data, challenge the data to really, again, find the specific approach for that particular healthcare system, those particular users.
Yeah. Colleen, is there anything about sort of understanding that community context that you have incorporated into your work or designs?
There's a lot of different ways in which you can engage within the community. I think from my personal experience, the one that I have seen utilized the most is through artwork programs. I've seen several different health systems create entire set aside some of their project budget and really do send out a true RFP, and they engage with the community to have, to purchase their artwork, and I think that's one of the most prominent ways I have seen a facility really engage from an interior design, certain perspective. Of course, we're always thinking about, like what Mark was saying, that whole outside space. How do we, sort of make sure that it blends well with everyone around, and then provides, if we have that opportunity, to provide additional green space between, the facility and shared space that the community can use.
Yeah.
If I can just dovetail on that idea of artwork, again, another project that we did for Chief Andrew Isaac up in Alaska that really served the native population, indigenous population. What we did was work with our graphics team to celebrate all the medicinal plants that they have used throughout their kind of culture and history. And those became part of the motif on the interior. And again, not only spoke to the patients and visitors and families, but the caregivers as well, that really gave them that sense of connection to their history.
Yeah.
That reminds me, Mark, of that Harlem project where they were building that community hospital and really wanted that building to reflect that it is there for the community. And they had happened to find this beautiful artwork that reflected sort of the history of the African American experience. And the building is clad on the outside with that artwork and imagery to really connect, to really demonstrate this building is for this community, and it's recognizing and acknowledging that and welcoming them. So I do think that art and the visual aspects of things is a really powerful way to connect first and foremost, and reflect your identity and what you think about the community.
Yeah, I love what you're both saying, and partly because as a clinician, I find one of the things that's most valuable if I think about my patients is if they can engage and truly partner with the healthcare organization, then they tend to have better medical or health outcomes. And it's not just for that one episode where maybe they were acutely ill, but really the continuum. And so potentially by creating an environment where they see themselves reflected, or they see themselves as part of that experience, or they feel comfortable and at ease, that they might be more likely to engage and stay with that organization, or seek out support from that organization, even if it's just, or if it's something that's more dramatic. I feel like when you're designing those spaces that you've just described, I imagine myself as a patient wanting to go there because I could feel at home and feel like I was, would be supported there, welcome. Is that some of your thinking, or does that track along with what you thought?
Yeah, I think, and as you said, engaging the patients, I think one of the most fulfilling projects that I've been involved in is where we as designers can actually engage with the patients. Often our clients will allow us to meet with patient groups or family focus groups to have those conversations, to really kind of dig into what is important to them, what will make it meaningful. Just a concrete example is at Ohio State University, where we were engaged with patients. And one of the things that we often talk about is patient privacy and dignity. And when you think about the patient room itself, there's the door, there's where the patient's head goes. And as designers, we often think, we want to give the patient the most privacy. So we'll put the bed, in a sense, where it's screened from the door. And we talked to the patients about that, and their response was, well, we're very sick. We're here at the hospital because, our life is in a very fragile state, and I want to be seen. So I would prefer to have my face near the door, so that if anybody passes and they see that I need assistance, they're there for me, and they won't feel alone and isolated. So that was really an aha moment. And I think that's where, again, it personalizes it for those users as well.
Yeah. We just had a really great question from one of our audience members that wants to know, what strategies can we use to balance clinical efficacy with emotional comfort in healthcare spaces? This is really interesting, because I think what you just described, Mark, is thinking about, there's the idea of creating a private environment for somebody who might be sick, but from a clinical perspective, being able to be seen, important to make sure that we see things early, that maybe a condition or symptom that the patient is wants to be seen by the clinician immediately. Any strategies besides the placement of that head of bed that you've thought about, that might help us think about the balance of those two pieces?
Well,
I was going to actually, sorry, Mark. Nope.
No, go ahead, please.
I was actually going to use your word, Sarah. I think when you want to balance the medical, I'm going to use the word efficacy, the efficiencies, the operations, with what, as designers, what we're trying to do, in terms of creating that experience that might feel, we want to create that experience that feels less clinical within this very clinical environment. We've said it already, there is no cookie cutter answer to any particular project or client. It really is instance by instance, where we have to talk about that balance. That's what it's a balance, and it's a give and take. And then it becomes down to, prioritization of one, or the other. Or can we find some wonderful magical solution in the middle that, when you have those moments where you can make everybody happy. But it's talking about it, I think, is one of the most important parts of it. As designers, we never want to surprise someone with, well, this is now how things are going to look and operate. That never works, right? That never works. Right. That never works. So open dialogue, I think, is probably the biggest tool in assuring that we can achieve both, making sure that everyone is interested in achieving both. I think that's also really, really important. There is no bag of tricks. That's how you get here, right?
Yeah,
that's
absolutely.
How you get. It is truly every client, every space for every client, every floor could have a different prioritization. It's really great communication, I think, is the most, and making sure your goals are in the same place, and then understanding where everyone is going to push and pull. in order to achieve that, a balance.
Yeah, I think that there's definitely that. And just kind of as Mark described, it's that idea that there might be if you're doing, as you say, Colleen, and engaging in a dialogue with users to say, what's important to you? What are the priorities? What are the important things? And you certainly could make an environment sort of less sterile, less clinical. You could make it, with various design elements, you could sort of make it feel more soothing or more at ease, but still acknowledging that the reason why you might be in some environments is because you do need to be observed for your safety or for the quality of your outcome. And so, but having that conversation is important because it might be that we've learned, as Mark did, that they actually want to be seen rather than be hidden behind a door. Or maybe that feels.
I think it's also too about. I was going to say it's also too about how we allow caregivers to feel connected to each other as well, and in that there is, because many caregivers feel isolated as well, and so creating those spaces where, again, maybe there's a moment in their space where there's a place for daylight that they can, bump into each other and share a moment or collect their thoughts. So often caregivers are only given access to light when they walk in the patient room. So I think we also look for spaces that might be near the care team station or might be in a respite space that, again, encourages that well-being as well for caregivers.
Yeah. Shifting a little bit to those other persons, we've talked a lot, I think, about the patient, maybe touched a little bit on the family, but let's think a little bit for a moment about the caregivers, going from what you just started to talk about, Mark. And we see so many different types of people that are supporting the patient outcome. So it might be a clinician, it might be a researcher, it might be a role, everything from somebody that might be in facilities and engineering, somebody that might be in nutrition, somebody that might be, again, researcher or clinician. Are there environments where you have really thought about co-location of certain roles that you think really has been something that's been unique in the design?
I'm finishing up a project right now where it was really important. It's a cancer hospital, the Jack and Cheryl Morris Cancer Hospital in New Brunswick, and it was very, very important to that administration that the clinical labs were inside the building, really to truly have that opportunity to bump into clinicians in the hallway and have further dialogue about research, about specific patients. I think that's taking it to a very interesting, and now I don't want to use the word unusual because certainly there's a lot of laboratory within, healthcare facilities, but this was a very purposeful gesture. To have that embedded within that facility to encourage that level of dialogue with each other.
Okay, yeah.
And we even did something similar at Ohio State, where they actually took the wet lab and put it on the patient unit and put it on display. And it was all about not only making sure that research component was integral to the care team, but patients and families that happened to just kind of walk by that lab knew that they're working on something that is specific to my need and my care, and it's right there. So talk about bed to bench side or bench side to bed.
Yeah.
That was really an interesting example of where we were able to work with the client to come up with something like that.
Absolutely. And I can imagine as a clinician and a patient or family member, the idea of having this physical representation that collaboration between clinicians and researchers happens would be such a strong or powerful signal to say, wow, this organization is really taking my care to the next level. And they're sort of walking the walk, if you will. It's not just talking about we do research or we do whatever, but it's actually, I can see it happening and what kind of message or, that might say about an organization's brand. But I think also how comforting, for those conditions which we know are still emerging in terms of how they might solve the challenge of their condition, to be able to see that there's people actually working on that is great. I also like the idea having that clinician and researcher together, because it may give the chance to tell the researcher, hey, I'm seeing this new problem, or I'm seeing this, and allow them to explore, kind of their ideas a little bit differently. It sort of, those collaboration spaces sound like an important part of our designs going forward. Any thoughts about more of those collaboration spaces?
Well, again, we had another example where during the planning process, we did some physical mock-ups, and it was of the care team station. And the comment from administration was, well, this looks like the same thing we've been doing for 20 years. Why is it that way? And through that dialogue, it was about how do we create those collaborative spaces. So the whole care team station disappeared. It really became a hub in the heart of the unit without the traditional counters. There were touchdown spaces, little teaming spaces, and it was really at the crossroads where all of those clinicians and researchers and associated caregivers were there at that heart. And it was that kind of opportunity, as you were saying, hey, I'm seeing this. What do you think of that? So again, it's really out of our clients. Many of these ideas can come and then we build on it. So where design really is a truly collaborative process.
Yeah.
What I really like about what Mark was just talking about is we're often doing mock-ups of the patient areas, the treatment spaces. But if you can have an opportunity to do a mock-up of those collaboration areas, to your question, Sarah, about how do we better them? How do we provide for them? Even simple cardboard mock-ups to really encourage people to think about how are you communicating with each other and can we make it better? Because everyone is, they see a plan and sometimes they understand what we're signing off on, and sometimes it can be a little ambiguous. And they feel like we're doing right. No one goes into anything thinking, we're actually making this harder for ourselves. But an opportunity to do a mock-up of the staff spaces, particularly where you want to encourage communication, I think, could benefit projects tremendously. Not just, let's do a mock-up of the head wall and make sure we have the gases in the right spot, but can we double check and make sure that we are communicating well and not maybe duplicating what we already have, but like improving on it.
Yeah, absolutely. So that mock-up, as you've described it, Colleen, is a really great way for kind of two pieces. One, it sort of sets up the opportunity for you to do that solution finding that makes sense within that organization's culture. So we've talked a little bit about making sure that it's not this copy and paste related to the way that they function, the people that they treat, how they collaborate, how they work. So that mock-up space gets the user, that frontline user, in the moment to say, I would like this wall here. I'd like this space to be slightly different configuration. The other piece I wonder about is for those people that do get to participate in the design experience. And once the design is born and it comes to day one, we're moving into this space. I'm curious about, I don't know, I have had the experience of going back with clients and having them say, hey, I helped make that decision. And the sense that creates value. And I wonder about that from a perspective of, since our experience with the pandemic, we've known that healthcare environments have had a real difficulty with burnout and things like recruitment and retention. And so getting that engagement as you've been working with them to sort of collaborate and design these spaces, do you ever wonder about your contribution, or do you ever get the feedback about that, being able to contribute to this dialogue about design, helping people feel like they're part of the solution? Does that change the user experience from during the design process? Any thoughts about that?
Well, I think when you said it, again, that just kind of is the thing that charges me, is when we get to engage with those people. And in a sense, they feel like they've designed it. Isn't that what we want to do? We want to be there. Right. We want to help them. But we go away and they feel like, oh, this was a wonderful process and I was heard and I was listened to. And I feel really proud about this space that I designed. So that really is just the cream, on the
Yeah.
on the cake when we
Yeah.
get our clients that excited and our colleagues can walk away with that experience.
Yep.
I have had senior leadership, envisioning sessions, make it a priority of they want the staff to feel heard and feel as if they thought of me.
Yeah.
And I think that does, when you can incorporate that through all of that engagement and ensuring that you're hearing and reacting to what you're hearing, I think that does lend itself to an easier acceptance of change, and everyone being a little bit more excited and less trepidatious about moving. And then it lends itself to staff retention, staff happiness, when they feel they've been heard and they feel that they have been thought of.
Yeah.
I think that's a game changer for staff.
Okay. Yeah. I think as we just, thinking about all of us spending so much time on our phones or other technologies in the last numbers of years, and it seems to be ever increasing, I'm wondering how we balance new technologies with the user experience. And, there's this risk of potentially having too much technology that would sort of dehumanize the experience. That it's really, you feel like you're maybe just interacting. I know if you make a phone call to some services, maybe your bank or what have you, it's all automated. And wondering if there are sort of approaches that you've used to sort of select technologies that would, make things easier to do, but not, make a negative experience for patients or staff. Any thoughts about new technologies in your design spaces?
Well, I mean, everybody's talking about AI right now, right?
Right, right,
And
exactly.
what is that going to do for the, helping caregivers, helping patients? I think one of the things that's most intriguing is, how it can even further personalize the experience. And, we are all now kind of getting asked questions, what is our preference for this? What is our preference for that? And, what I like to think about is how can we make the building itself empathetic? And how can technology, in a sense, know me when I walk in the door? So it understands I've arrived. It adjusts the lighting to what makes me feel comfortable. There may be music, there may be color. So I think there are a lot of ways that can enhance the user experience.
Yeah. Yeah.
Yeah. The big conversation around technology right now, because it is so vast and there are so many different options, but there is a large recognition that your connectivity, it is the hospital's representative in your home, is that technology on your phone. It's understanding right now that it doesn't start at the front door any longer, that your experience with that hospital begins at home on your phone or some level of technology. That's a very big conversation. And then with adding on with what Mark said, how do we then connect that to the front door? And a lot of it is in terms of, experience is utilizing it in a positive way to make it more personal, because it's so much easier now. And then that puts people at ease. And, then that care team can have a stronger conversation when family members and that patient are at ease.
Yeah.
It's how do we let technology be in the background? I think, Sarah, you said once, how does it take over the mundane so that it really frees up the space for that human interaction? I think that's really what we want to get to, is how can we enhance that relationship?
Yeah, absolutely. And I think it kind of, as you're both talking, I kind of go back to the points you were making earlier about, choosing design elements that represent the community, that I see myself reflected in the design of the campus or the building or the environment. The technology echoes that, right? So we're selecting technologies that continue to let me feel like I've got a partnership, that I want to approach it. It's not off-putting. It's not something like, oh, I'm dealing with a robot. It's augmenting my connection. It's drawing me in. The last thing you want to do is get, as you're going to register for something or sign in, you've just don't have the option to create that human experience. And so you're right, Mark, we automate the mundane and we humanize the sort of experiential pieces, I think is making sure that it is staying focused and staying personalized as much as possible. We are coming close to the end of our time, and I'm just curious if there's any things that you think from either one of you are any of the big missed opportunities that we're maybe experiencing in design today in terms of experience from providers or patients or staff. Any chances that you think we maybe have missed, we might have missed something or something that's on the horizon that we should just touch base with quickly?
Well, each project is a step into the unknown.
Yep.
And so I think we're all discovering what's next. But I think the most important thing is that with healthcare, we always know that it really is about creating positive outcomes, both from a relationship standpoint, but also from healthcare delivery. So I think we're all discovering that together as we move forward. That's
great. Good. Well, I want to say thank you all for joining us today. We're glad for the great questions. And we also, if you're watching this later, feel free to drop a comment or question, and we'll continue the conversation. We want to keep an eye out for a replay of this article and a recap coming soon. So thank you very much for your time today. I enjoyed speaking with you both.
Thank you.
Thank you.